everyone, welcome back to my YouTube channel, and this is going to be my last video on my rhinoplasty update. So first things first, I'm going to be doing this video in full English. So kalau misalnya kalian ada yang butuh subtitle bahasa, please klik tombol CC yang ada di bawah and then you will get the subtitle there. Okay guys, so if you're watching this video, I assume that you have watched the 3 previous videos of my rhinoplasty vlog. And I did my rhinoplasty in Korea, in South Korea. The name of the clinic that I went is JW Clinic. I did a derotation graft and an alarplasty. Alarplasty is making the wide of your nostrils smaller. Yes, this part, and it's smaller than before. I will show you the before after video and photo very soon. And the second one is derotation graft, which is taking the cartilage from my ear, my right ear. They put the ear cartilage on my nose tip to make my nose more pointier and higher, and then they put the silicone on my nose bridge. That is a rhinoplasty by derotation graft. I did my surgery in JW Clinic with the help and assist of Beautique Korea. Basically what Beautique Korea do is they will assist people who would want to get a medical treatment in Korea, particularly in beauty such as plastic surgery and skin, and they will assist you if you do not know where to start, which clinic to choose, where to stay, which doctor to choose. So they will really assist you in that. They will even help you translate. They will also help with your transportation from your hotel to the clinic. If you ever want to read more about Beautique Korea, please go to their website at www.beautiquekorea.com, or I will leave the link in the description below. So I did my rhinoplasty at around February 2018, about a year ago, and today is February 2019. It's exactly a year after my rhinoplasty, and for those of you who would like to see my before after photo, here it is. So I'm putting 3 stages of my photos here. This is me before my surgery. This is me right after my surgery. And then this is me about 6 months after the surgery. So when a person does a rhinoplasty, the nose after the surgery will not be the finished look. It will be a little bit bulbous, a little bit huge on the bridge area because it's still very swollen. That's why the doctor and the nurses at the clinic told me that the finished look will be around 6 months after surgery. That is when you know that you have your final look. Here I'm also showing you a video which you can see exactly what is the difference between me before surgery, exactly after, and then 6 months after surgery. You may think that it might not look too different, but I did ask the doctor that I wanted a natural looking nose but still a higher nose bridge and nose tip. And now I'm going to share with you my thoughts on the result of my rhinoplasty. So this rhinoplasty is the very first surgery that I have ever done in my life. And am I satisfied with it or not? Yes, I am satisfied with it. I am 85% satisfied with my rhinoplasty result. So I will explain to you why I'm not yet 100% satisfied with my rhinoplasty. So right after my surgery is finished, there is a staff from the clinic that told me the doctor did the alarplasty with no problem at all, and they also put the silicone with no problem at all. When they're about to stack up some layers of ear cartilage on my nose tip, they were planning on stacking 3 ear cartilage so that they will achieve this curve, you know, a little bit of a pointy button nose, because that's what I requested. They were adding up to 2 layers of ear cartilage, and when they were about to layer the 3rd one and they were about to close my skin back, they realized that my skin was kind of tight and thick, that it cannot hold 3 layers at that time. So some people's skin do stretch. When you put some implants inside your nose, you need to have your skin stretch, right? Because there is more volume inside. So my skin stretched, but not that much. For people who have their skin stretched easily, it will be easier to put more inside, like more implants, and getting the height that you want easier. But for me, my skin doesn't really stretch and it's kind of thick. That's what the doctor told me. So at the end of the surgery, they decided to just put 2 layers instead. So this is what they achieved on the first surgery. So after the doctor told me about the result of my surgery, I then asked him, is there any way to, add another layer? Is there any way to, revise it? And the doctor told me, yes, of course it can be revised, because if you get a rhinoplasty, it's a very common thing to have a second or even a third rhinoplasty, which is like a revision. After I shared my rhinoplasty story on my social media, some of my friends who previously have their rhinoplasty reached out to me and then told me their story, which I'm actually very happy to hear. I cannot tell you who they are because I would like to respect their privacy, but I will tell you about 2 cases of people that have kindly shared me their rhinoplasty story. And I'm sharing to you this because I want to let you know that revision in a rhinoplasty is actually pretty normal. So the first case is a friend of mine. Let's call this person A. And he told me to achieve the nose shape that he has right now, he needs a total of 3 rhinoplasty or 3 nose surgery, and he is now finally satisfied with what he has. He also does the same kind of rhinoplasty as me, using the ear cartilage. There are some people, if they do rhinoplasty, they do it with their rib cartilage because they need more, support. To achieve the shape that you want, using rib cartilage is actually easier because rib cartilage itself is pretty hard. So if you want to push your skin a little bit higher, it can give the support that you wanted. But ear cartilage is a little bit softer. In return, they will give you this very flexibility that it doesn't hurt. Whereas if you use rib cartilage, this is not possible. But you will get the shape that you want easier. So there are pros and cons between ear cartilage and rib cartilage. So A also told me that he achieved his nose gradually because he also doesn't want to push the skin of his too hard, because if you are having a rhinoplasty and you're forcing to get that high nose on the first go, and if your skin doesn't support that height, it can actually bend. Let me tell you about case B. B is my friend too, and she is kind enough to share with me her story. She has done 2 rhinoplasties so far, and the first one, she achieved the very high Western kind of nose that I think a lot of Asian doesn't have. So after about a couple of months, her nose starts to bend to the side because her skin cannot support that much volume inside. The skin just wants to push back to the way it was. She realized that she might ask the doctor to have the nose too high, so she consulted her doctor again, and she wanted to have her nose reduced, the height reduced, to finally get that straight but still kind of pointy nose. So she did a revision for her nose surgery, and the doctor lowered the height of her nose, but I'm not sure why. After a couple of months is fine, but another 4 or 5 months, she says, the nose starts to bend again. So what I'm trying to say is, it is okay to get your first rhinoplasty and is not fully satisfied with it than to force getting the perfect nose, but there might be some side effects later. Like in my friend's case, her nose is bent because she put too much height and the skin wasn't ready, and so on and so forth. It is also obvious that because I'm telling you this, I am going to get a nose revision. In fact, I am right now in South Korea, a year after my very first rhinoplasty. I'm going to get my nose revision tomorrow. This is why I'm making this video tonight, because this is the only time left that I can show you my rhinoplasty before the revision tomorrow. What the nose revision will do is that it will not change the bridge. There is an implant already inside, and I'm already very satisfied with my nose bridge, but I would like to make the nose tip higher So what they're going to do on the nose revision is they're going to take another piece of ear cartilage still on my right ear. So they're trying not to use this left ear at all. So my left ear is still 100% untouched. They're just going to keep using my right ear cartilage, and then they're going to try to layer 1 to 2 layers of ear cartilage to achieve the nose tip that I want. And because of that, I'm going to be making another surgery vlog about my nose revision. So if you're ever interested in watching, please do stay tuned because it's all going to be on my YouTube channel. Surprise, surprise! I'm also going to be doing my surgery with my boyfriend, and he's not only going to accompany me getting my surgery, he's also going to get his own eyelid surgery. So yes guys, I have finally shared with you my before after photos and videos of me before my first nose surgery and after my first nose surgery. I have gotten a lot of requests when I would post my before after, because until now I haven't posted my before after side by side. Now that I've posted to you guys, you can now see the difference between me before my nose surgery and after. So wish me luck for my nose revision tomorrow, and I will definitely share with you everything on my social media. Please do check out my social media links below. Thank you so much for watching this video. I'll see you next time. Bye guys, love you.